We are still continuing this syndromic approach, which is part of the sexual transmitted diseases, how we treat them. I'm still a registered nurse. Modrik's is my name. And we are still looking at now the symptoms, and we have so far seen the two symptoms, abnormal vaginal discharge syndrome. We looked at it already, and the urethral discharge syndrome. Now for today, we are looking at the lower abdominal pain syndrome, and it's common in females. And we are looking at what causes it, investigation, and how we can manage someone using a syndromic approach if he possesses the lower abdominal pain syndrome. The cause of this LAP, we are looking at the infection of the uterus, the fallopian tubes, the ovaries, majorly by Neisseria gonorrhea, chlamydia, and other anaerobes. They are the main causes of this lower abdominal pain syndrome. And the investigation that you can do if this female possesses with lower abdominal pain syndrome, we're going to take history and also check if period overdue is almost in period or not. And we are saying, if possible, examine the patient biannually for pregnancy, bleeding, recent delivery, or abortion, because some of these may be the cause of this low abdominal pain syndrome. Check for severe pain, vomiting, and rebound tenderness, but mostly that has been history. We are going to do urinalysis, and this will help to rule out UTIs. Remember, in syndromic approach, we said even we don't wait for this investigation. We treat symptomatically. So we shall do this urinalysis just to confirm the diagnosis, but treatment, we shall have started it. How do we manage someone who has lower abdominal pain syndrome? We are saying if he has any of the above symptoms that I have talked of, we are going to refer for management. But before we refer for further management, we are saying most times you're going to give ceftriaxone 1 gram IM, although the IM route is painful. If you do this, then use liginocaine to see that you control pain. So preferably you could use the IV. And then you can either give cefixime after now a dose of the first dose of ceftriaxone. The patient now can continue cefixime 400 milligrams once a day for now 3 days. You can add either of these two drugs in addition to cefixime. You can use doxycycline 100 milligrams 12 hours for 14 days. And you can use metronidazole 400 milligrams twice daily for 14 days. These are antibiotics of choices that you can use to treat low abdominal pain syndrome. And in this case, we treat sexual partners for urinary discharge syndrome. We treat them all. Otherwise, if we treat one, it may be the urinary discharge syndrome that may have caused the lower abdominal pain syndrome. And we are saying if there is no improvement for 7 days of those drugs, we are going to repeat ceftriaxone 1 gram once daily for 3 days. And if there is an intrauterine device, we are going to remove it 2 to 4 days after commencing treatment, so that it may be the source of making the infection ascend. If no improvement still within 7 days, then here we refer the client for specialized management. Thank you for listening. That's how we can manage lower abdominal pain syndrome using the syndromic approach.